breast cancer remains the most common cancer among women in the Philippines. And an upcoming event this month is aimed toward helping women better understand and prepare for the disease. Breast surgical oncologist Dr. Emmeline Elaine Cua Delos-Santos of St. Luke's Medical Center, Global City, now joins us live via Zoom from Singapore. It's a beautiful day, Doc Emmy. Good morning. Welcome to the show.
It's a beautiful day. Good morning, everyone.
Now, Doc Emmy, breast cancer is something that affects millions of women across the globe, and not everybody realizes na it has different types. And of course, with different types of breast cancer, there are different challenges and different treatments, right? So let's talk about that first. What are the different types of breast cancer?
Actually, the most common type of breast cancer is called invasive ductal carcinoma. And the second most common type is the invasive lobular carcinoma. So the difference of this is actually where it originated. So one is from the milk duct and the other one is from the milk producing glands. So they're a bit different, but the way we manage them is a bit similar. Okay, but now in this generation, we now talk about personalized medicine. So we do a lot of breast tumor panel testing, so we can figure out which one are more slow growing and which ones are more aggressive, like the triple negative ones and the HER2 enriched ones.
Now, Doc, are there early warning signs and symptoms of breast cancer? Because it's scary as a woman, we need to know.
You know, why we advocate breast screening is while you don't feel anything, you don't have any symptoms, that's the best time to do the screening. But of course, it's not fortunate that everyone does breast screening. So the most common sign that you will notice is you have a breast lump or some breast discharge or some asymmetry in your breast. Yeah, and sometimes there's some nipple inversion. So actually, most of the time, patients are worried when it's painful. But we always say to our patient when there's pain, actually, it's most of the time that's caused by hormonal changes. When there's no pain, that's actually more worrisome.
Doc, I remember my OB telling me that as soon as you hit 40, you need to have your yearly mammogram and breast ultrasound. Is there a certain age na this is when they should start getting tested, and how often should they get these particular tests?
So actually, the year for moderate risk women, the start of screening is at 40 years old with a mammogram and an ultrasound. So you're correct when you say about that. But for those with high risk, those with family members that has breast cancer, so we advise them to do it at the breast screening 10 years before the age that the family member was diagnosed. So between the age of 20 to 40, you do your monthly self-check. Okay, just be familiar with your breast and do an annual checkup with with a surgeon.
Doc, we always mention how important screening is and early identification and making sure that we catch it early. We mentioned 40 years old as well, but then even for some of the younger people who are already concerned, because as you mentioned, minsan may konting high risk. Is there actually, in your opinion, is it still too few, the amount of people who do get pre-screened early on when it comes to trying to identify whether or not there is breast cancer developing?
Well, one proactive way of looking at it, it was so famous by that time. Angelina Jolie did her genetic testing with BRCA gene, and then she had her double mastectomy. That's one proactive way of combating this breast cancer and of what you can do. And luckily, this is already available in the Philippines, so you can get yourself tested and know that your risk early. But you can also go to your checkup with a breast surgeon, and then you can have your risk computed. This is a fad in the US right now. A lot of people do it. They go early at a younger age, have themselves checked, and they do some special tests like a breast MRI. Those are additional tests they can do, and they actually catch them early before they feel anything.
Yeah, Doc, it's so interesting that you mentioned that about Angelina Jolie, because I want to know, how does family's history impact a woman's breast cancer likelihood?
Yeah, so actually, every person has 25,000 genes. And right now, what we only know in the world is like 90 genes that are related to cancer. And not all of them are actually related to breast cancer. So we're still figuring it out. So once we test, what we really know that is connected to breast cancer is the BRCA1 and 2 gene. So when you have that gene, that's almost like 80 to 90% chance that you'll get breast cancer, and there's something you can do about it. However, like even if you test negative with that, you should really do a screening, a close monitoring for yourself, like every 6 months or every year,
Mhm.
so that you can catch them early. Because there are still like more than 1,000 genes that we still don't know about.
Doc, we're talking about women and breast cancer. Little do people know that men can actually get breast cancer as well. How does it present differently, Doc?
Actually, in men, it's so rare, and most of the time, it's really because of genes that the men get breast cancer. Only 5 to 10% of breast cancers are actually genetic. So 19 to 95% is really like some mutation that happened in our body along the way. So for men, it also presents the same way. And most of the time, men will not be advised to do monthly self check. So they really just usually come and present with a breast lump, and that's when we do further workup, do some genetic tests, and that's how we know that it's breast cancer. It's actually treated the same way.
Okay.
So, Doc, if we know we have a high risk of getting breast cancer, so apart from the screening and all that, are there any lifestyle changes that we can do to help reduce the risk of breast cancer?
Yeah, so I always advise my patients that living healthily actually will help you avoid all kinds of cancer. So, you avoid these processed foods, eat those fresh produce,
Mhm.
and then do exercise like 30 minutes a day. And then, of course, maintain an ideal body weight. That will really, really help. And of course, avoid smoking, alcohol, and all that.
Doc, you mentioned a while ago about, checking it yourself, or there are methods to check for breast cancer, the self-screen. But some people may be worried about yung effectiveness nila. Maybe they do not know what they're even looking for, or if something is natural or not. How effective are those methods? And of course, what would be the most appropriate way to do it, or at least the most effective way of making sure that, if you're going to at least try it yourself, na tama yung ginagawa nyo?
So if you don't know yet how to do it, I suggest that you please consult a specialist for
Yeah.
it, a breast specialist for it. Then you will be taught how to do it the correct way.
Yes.
And you just make sure you examine your whole breast every month. That's 7 to 10 days from the first day of menses. So if you had your menstruation start at March 1, so you do your monthly self-check at March 7 to 10. And then just be familiar. I always tell my patients, you're not looking for anything. That's not what we want. But at least you're familiar, so that if there's like a slight change, you'll be alarmed and like seek consult at once.
Doc, can breast cancer be treated without surgery, or is surgery always necessary? And are there new technology, meron na bang new technology that, is better at detecting and also treating breast cancer?
First and foremost, surgery is the cornerstone treatment in breast cancer, in early stage breast cancer. And then there are many aspects of breast cancer treatment nowadays. So there's always a 5 areas around it. So there's surgery, there's chemotherapy, there's radiation therapy, there's hormonal treatment and targeted treatment. And lately we have this new treatment called immunotherapy. So I always tell my patients, surgery is still cornerstone treatment for cure, and all these other treatment will just help improve your survival and lessen the chance that it comes back. Yes,
You,
and we
me-
all have it here in the Philippines. They're
Okay.
all available here.
you mentioned the likelihood for it to come back. A lot of people will be wondering, and of course, a lot of people are curious just to know about the success rate of surgery, of treatment. I know it depends from a case-to-case basis, but in your experience, on average, what would you say is the likelihood of breast cancer returning after successful surgery first?
Well, it's actually around 2 to 5%. Even with successful surgery, I always tell my patients, you still have to come back and see us. You cannot just like not see us after, because it's really very important. The close monitoring and follow up, because if it's returning, it's usually within like the 2 to 5 year period.
No, Doc, I want to go back to the surgery aspect because I know in the US over 90,000 women go and have a double mastectomy or a mastectomy, and it's mostly for preventative measures. What are the numbers here in the Philippines for women getting preventative mastectomy or double mastectomy?
Actually, it's more of here in our country, it's more of like personal choice that they just want them to remove it because like they have breast cancer in one side, they just want them to remove the other side. But technically, they should actually be tested BRCA gene positive, because those are actually the subset of women who will really benefit from a surgery on the other side, the normal side breast. As to the prophylactic, like what Angelina Jolie did, the problem is like within the Philippines, I guess with the limited resources our patients have, not a lot get tested, like not a lot get genetic tests, so not a lot undergo those prophylactic double mastectomies.
Now, Doc Emmy, let's talk about this upcoming event that you have on March 23. It's aimed at breast cancer wellness and recovery. Can you tell us more about this?
Yes, so on March 23, with this in collaboration with the Junior Chamber International Makati Princess Erduja chapter, the Eye Cancer Foundation, and TGP. Thank you for all this. This is open to all breast cancer survivors. So this is one of the first survivorship clinic here in the Philippines. So we want to address all these other concerns that our breast cancer patients have, because we want to help you have a good quality of life as you integrate back to the society. I always tell my breast cancer patients, this type of cancer gets well, and after some time, you might actually forget that you had breast cancer.
All right. Thank you so much for your time, Doc Emmy. Thank you for joining us today.
Thank you for having me. Good morning,
Ladies and
everyone.
gentlemen, breast oncologist Dr. Emmeline Elaine Cua Delos-Santos from St. Luke's Medical Center, Global City.